Hello, I'm Chad Saley with Comp Health. I'm sitting down again with Dr. Andrew Wilner, the author of A Locum's Life. And today we're actually talking a little bit more, we're talking about what's going on in everyone's world right now, the coronavirus. Dr. Wilner, thanks for sitting down with me for a few minutes and telling us a little bit about how, coronavirus maybe is impacting the way that you practice and what you do. Obviously, being on the neurology side of things, that's not one of the, I would guess, not a hugely impacted specialty, but maybe you could shed some light on that and just kind of how it's impacting you as a physician.
Well, thanks for having me, Chad. It's a pleasure to be here. And it's April 3rd today. We'll look back a month from now or 2 months from now. I'll say, we don't really know where we are in the midst of this. Is this the middle? Is this near the end? Is it near the beginning? We'll know more. I think there's a lot to comment on. I'm actually researching an article now. Is there direct invasion of the brain or the nervous system by this coronavirus? And the answer is we actually do not know yet. There is some laboratory evidence that this could be true. There was a paper that just came out from Wuhan that was a retrospective series that showed that a third of patients had neurological symptoms, dizziness, confusion, even stroke. But that is very much colored that when patients are in ICU for any cause, say they've had a heart attack, dropped their blood pressure, they've had a big stroke, they've had some other disease. It's not uncommon for them to have confusion, headache, dizziness. So it's a little unclear whether the neurological symptoms that accompany this virus are secondary to just being really, really old and sick, because those are the people in the ICU usually, or if the virus like rabies virus, directly affects the brain. So there's a lot of research right now to try and sort that out. I'm actually trying to put together what we know today. And I think based on what we know today, we don't know the answer yet. But I think we will know the answer soon. And it really is an important question because if there is direct neurologic involvement, then we're going to look for a specific treatment for that. If it's just a matter of, gee, these patients get so sick that then they have seizures and they have this and they have that, well, then it's just a matter of, well, we got to treat them when they're so sick and try and avoid those complications, which is what we always do. So that's a very interesting thing because this is a new virus, so nobody really knows. In terms of the work life, right now I have a permanent position that I got because I learned that 7 days on, 7 days off works for me. And I'm at a teaching institution. So I've been continuing to go to work, even though I'm in a high-risk group. And I do have some trepidation about it. Neurologists are not on the front line usually. We don't staff the ER, so we're not just seeing all comers. And what we've done, actually, they've instituted in the ER because of the shortage of PPE, personal protective equipment. Say there's a consult in the ER, patient's confused, we want neurology to see the patient. It's like, well, that patient hasn't been tested yet. So we don't really know if that's a COVID patient or it's not a COVID patient. And so you do need to protect yourself. And then you need to use PPE. And the more people that see the patient, the more exposure there is. So the hospital has actually instituted a telemedicine program, just the way we would do as if the patient was at an outside hospital. It's like, okay, well, let's do telemedicine from the ER, just upstairs to my office. And the resident will do telemedicine interview and can examine the patient, with a helper who's already been exposed down there, and kind of get 90% of what we would do as if we were there in person. And if the patient does need to come into the hospital then they'll get screened. And we've established a special ward for suspected cases and definite cases. So at least everybody knows to be, excuse me. So hopefully the cough, I think it's just allergies. But so hopefully, at least people will be extra careful in this special ward now of the hospital. So we know that's the COVID, area. Of course, you could be exposed anywhere without knowing it, but it's nice to at least define an area. So our hospital has instituted this telemedicine program, a special ward. The other thing is just to get into the hospital now, everyone is screened at the door with a temperature screener. They have a thermometer, they use the forehead thermometer, and they ask you, have you been exposed, ask you a few screening questions. They don't tell you, but if you say yes to any of those, it's like at the airport, you're out. Any fire up, out. If you ever been a terrorist, out. And if you have a fever, out. You got to go see your manager, or if you're a visitor, then, well, visitors are just out permanently now. First it was, we're going to limit to 2 visitors a day. That policy has evolved, just forget it, no visitors. And that's really hard for patients. It's a bad time to be sick. I always encourage visitors. When I see a patient, they had a stroke or something bad has happened to them, the head injury, and the family's there, I said, it's really good for them, for you to be there. I know you have to go home and sleep. You can't be here 24/7, but your support is important. We want you there. It'll help the patient heal and communicate. And sometimes they actually offer important historical information. Oh yeah, by the way, the patient had this surgery or that surgery, or stuff they would never that you've asked them, but they never told you, but it comes in later. But now we're excluding the patient, the families and the visitors from the process. And so patients are really, you always feel isolated when you're sick, but now you really are isolated. And I think it's a bad time to have a heart attack, or a stroke, because the hospitals have really had to kind of lock down, control the flow. But the funny thing is, once you're in the hospital, we're just roaming around the hallways and, interacting the way we have to get our work done. And I'm not entirely comfortable with that, but that I see that as my job. So I'm trying to do my job and help, care for patients while, worrying a little bit about my own personal security. I come home, I ditch the clothes, take a shower, try and, I don't want to drag any of that into the house. Whether that helps or not, I don't really know. But, you just do what you can. But, people need medical care. Our hospital, where I'm in Tennessee, and we have not yet been overwhelmed by the virus. So I'm at a trauma hospital, so we still have car accidents and gunshot wounds and heart attacks and strokes, and just drug overdoses and all the usual things. Those haven't gone away. So it's like just COVID is just sort of superimposing, on that. And luckily, my specialty is not one where I have direct exposure, like the guy who's doing bronchoscopy, has to put a tube down the throat, or intubations, the patient's coughing all over you during that process, and you need the special N95 mask, or preferably a spacesuit, because you're going to get contaminated. What neurologists do, usually secretions isn't a big part of it. So that's, I never really thought about it that way, but that's comforting in a way. So there have been really big changes.
What maybe just one final thing, what would your perspective just as a physician be on kind of the country's response and the nature of this pandemic and kind of what it's done to normal life?
Yeah, so obviously our country's response was delayed. It wasn't appreciated by the president or the powers that be that this really was such a big threat. I only know what I read and what I see. I know there was a whole department that was set up to combat things like this that was dissolved, by the current administration. There really was not proper preparation. I saw a fantastic video by Bill Gates from 2015, I think it was, where he talks about how unprepared we are for the inevitable epidemic of a virus that is easily transmitted. I think this was in the wake of Ebola. And it turns out that Ebola virus, as lethal as it is, isn't that easily transmitted. And he said, if we get an Ebola virus that's easily transmitted through the air, and droplets, he said it's going to spread, and it's going It's just going to be devastating in terms of fatalities and the stock market and the economy and jobs. And we're not prepared for this. And you watch this thing and it's really creepy because he is just detailing everything that actually happened. That's happening right now, 5 years ago. I mean, it's a taped, he didn't fake it, right? I mean, you can't believe it. And the more I learned about that, the more I realized he was not the only one. There's some Nobel Prize winner guy who's been saying this for years and years that nobody's listened to, that our world is, so populated and so you can so quickly get from one point to the other in an airplane, that an infection in China ends up in San Francisco, a few hours later. And they've seen this with, ecological disasters. Hawaii, I'm interested in nature. In Hawaii, it doesn't have any native poisonous snakes. And they're just terrified that, one poisonous snake from Africa is going to be in the hold, some shipment, it's going to get out on the airport and it will just take over the country because the population there isn't, designed over, eons to deal with poisonous snakes. And this virus, came from a bat, it's from a bunch of viruses that hang out in bats. Well, somehow that bat ended up in the human sort of world. And then humans interact and are very close together. And next thing you know, kaboom, it's all over the world. And so no one has any immunity. It's a new virus. So, I mean, we could not have been less well prepared. I mean, we're just not prepared. We don't have the equipment. We don't have strategies. We don't have medications. We don't have vaccines. We're not set up to work from home. Everything is completely, ad hoc. And, I'm waiting if the internet ever dies, right? I mean, there's going to be riots in the street. Entertainment, ordering food, Amazon, working from home, programs like this, our ability to continue to live our lives and contribute. If the internet ever dies and then the gasoline stations run out of gas, I mean, it's going to be like a Mad Max movie, the world's going to look like that. And I don't think we're that far from that. So, I'm hoping that the curve here starts to improve soon because we're really not set up for this.
Yeah, I agree. We hope the same. Well, thank you, Dr. Wilner. We appreciate your insights and hope that you and your family remain well throughout the rest of this as we do the country deals with it. So thank you.
Thank you, and the same for you, Chad.
Thanks.